Welcome back. You're listening to Ask the CIO, sponsored by Vion and Dell on Federal News Network. I'm your host, Jason Miller. My guest today is Dr. Amy Abernathy, the Principal Deputy Commissioner and Acting CIO at the Food and Drug Administration. Now, Amy, before break, we're starting to talk a little bit about the pandemic and the challenges you guys had in really ensuring that you, as you said, your network was ready, it was stress tested, could really meet the needs of the remote workforce. And one of the things that occurred to me as you went through it is that last mile issue that you brought up, of making sure you can connect to that last mile. And the FDA is a very mobile organization. I mean, you have food inspectors, you have drug inspectors, you have people everywhere, not just across the US, but around the world. How were you able to kind of balance that with the pandemic to ensure they had the tools and the technologies and they were able to get their work done?
You're absolutely right. When I think about FDA, I was amazed to learn that I believe we have north of 250, maybe almost 300 sites where we have people around the world. And we, usually have people working internationally. And then, as you said, they're mobile as they go to different inspections and do their work. So that had been a part of our culture and what we had to plan for before the pandemic. And that has layered on to now our large teleworking workforce. How do we deal with it? There's the tools side, so making sure that everybody has access to reliable mobile phones and making sure that we are able to solve any networking problems and everybody's laptop works. That's one part of doing this. And we had that muscle already in place. We just had to make sure now it was working at scale as we've been dealing with both the teleworking workforce and our mobile community. But there's a couple of other things I think that's interesting about this. Another was that in the context of the Technology Modernization Action Plan, I mentioned that middle category of TMAP strategy where we are building tools and solutions where people can see, oh, now I get it. Here's how our technology organization can help us. And one of the issues is the decision-making as to what is happening related to the pandemic in a locale. So are the cases increasing, deaths increasing, are there enough ICU beds? And is it safe for us to send an inspector for a routine inspection, whether that's a food inspection or a drug inspection, importation, etc. And so what we did was built a tool suite that incorporated data from CDC and multiple national databases, coupled with what we know about the places that we inspect, that now serves up to our supervisors and others who need to make the decision, can the inspection happen in real time, to be able to give essentially a red, yellow, green signal as to whether or not we should be thinking about sending our inspector or our employee to that locale. And it was a really great example of, in the running fast activity of the pandemic, we could pull together multiple capabilities through that product mindset that's a part of our new Technology Modernization Action Plan strategy and solve a problem related to our mobile workforce.
I'm going to have to ask the question. You open the door, I'm going to walk through it. The cloud, that had to play a role in this tool suite, because if you have to access it from anywhere at any time, you can't be sitting back at the database. I'm guessing here, right?
100%, right? And so this is a cloud-based solution. It also helps to highlight the ability to essentially have a data lake-like solution where data sets are being pulled in into one place from multiple places. And also it highlights the analytic solution put on top that's not only a ability to have essentially a visual map of the United States or internationally, but in this particular case, we're starting off with the US, a visual map and a really quick signal of red, yellow, green, but also the ability for that tool suite to be virtually available anywhere because it's accessible through virtual means. It really made a difference.
I can imagine, because if you don't know, if you're an inspector and you say, oh, I have to go to North Dakota, what's happening in North Dakota, you may not know. And, to be able to look at a heat map almost and say, oh, that's not a hot spot. Okay, I feel comfortable going there, or I don't. So no, it's a great use. And it's actually also a great segue to that other part of the TMAP when you talk about proof of concepts and really saying, let's demonstrate those capabilities. You talked about the data lake. This also goes back to, you recently hired a chief data officer, and you have a CTO, a chief technology officer, that helps you kind of work through these maybe other pieces and parts. Walk me through why those two folks, and who are they, of course, are so important to this broader goal.
So as I mentioned, for our technology modernization action plan, a key part of the first component of our strategy was the technical organization itself, and how do we want to organize ourselves. And I, asked myself, who are the leaders we need in place to help to move this organization forward. And first of all, I want to make sure before I talk about those leaders that one of our approaches is a culture within our technical work that we're moving towards where everybody can be a leader, where we're really trying to surface the voice of our entire technical community. But we still need to have the senior leadership that can help advance the vision. And we hired a chief technology officer, Vid Desai. He came from industry and also has a private equity background, so really understands how to make sure that we keep the finances in check and the technology in check, and is also a very experienced senior leader when it comes to actually making sure we build the culture and the people, which was very important to our technical work. In March, we hired a chief data officer, and Ram Iyer also comes from industry. Now, he comes from the life sciences industry and really thinks about data, artificial intelligence, how do we build teams where one of the things he said in his interview where they can, where we can unlock the elastic capacity of our own people at FDA in helping to think about data and analytics, because going out and hiring a whole bunch of AI experts is probably not what the FDA is going to do. Instead, we need to figure out how do we build that muscle inside of FDA, and that's really his core skill set and what we hired him for. And now what we're doing is really thinking about how do we bring the 10x skills of each of the people across our overall technical work to the table so that everybody really is a part of the leadership. The other thing I would mention is we have a spectacular CISO, and security is very important to us. And our Chief Information Security Officer, Craig Taylor, has been a key part of our organization for a long time, and making sure we have the CISO voice is very important.
Especially when you talk about modernization, it's easy for security to get lost, but as you all know, we've all experienced the hacks and the data breaches over the last dozen years. So you're right, you can't overlook your CISO. When you talk about the third piece to the modernization plan, the third piece here is open channels of communications. Let me bring in the broader community. Let me look at the landscape of industries you talk about that you guys work with on the day-to-day basis to understand their needs and what they're looking for out of data. How are you starting to do that? And where is I'll kind of go back to the beginning. The cloud's got to play a role there too, because like probably with the National Science Foundation or with some of the other kind of scientific and medical agencies, they want to be able to share data as much as possible. So
this one is the most nascent of our three components of our strategy. So the one where I see us just getting going. And the way that I imagine us getting there is to have a series of listening sessions, to understand a landscape map of what technologies are being used across the industries we regulate, and also what technologies are being used inside the FDA so that we can understand how these might work together. And also to be able to develop new ways of surfacing, here's what we think is going to be important. Let me give you a couple of practical examples. As FDA, one of the things that's important to us is the conduct of clinical trials to test new drugs or biologics, because this is the way that we understand both safety and effectiveness of the medical products. We care a lot about the development of new tools and solutions that allow more facile and efficient conduct of clinical trials. So we want to see clinical trials be more efficient, but we also want to make sure that there's the integrity of the data of the clinical trial. So being able to help those industries that are building those kinds of software solutions understand what we think good looks like, and then also to build the facilities that allow, for example, the rapid transfer of data out of those solutions into the FDA so we have efficient data exchange are the kinds of things that we think are going to happen in the future. And we can't really point that way unless we can open up the communication channels to say, here's what we're thinking, what are you thinking, where does this go?
Currently, I imagine things are not paper-based. No one's sending you reams of paper, hopefully, when they do a clinical trial, and then you guys are scanning it in. There's probably a two-way electronic exchange, but what you're really looking for here is to make it more efficient, make it faster, make it just easier to do. Hence, the data lake, the enterprise data warehouse plays into that to a certain extent, too, I would imagine.
Well, Jason.
Well, it may be paper, you're saying?
So this was why when I came to FDA as principal deputy commissioner and thought I was going to focus on data, I realized first I needed to go back and focus on the technical organization. For example, an application comes to us electronically through our electronic gateways, but it's essentially digital paper. So most of the things that we receive are not digitized into component information that's readily analyzable, but rather is in human readable form. And so one of the big areas of focus before I came to the agency, but we've tried to accelerate that focus, is how do we start to create mechanisms for more and more structured data to be sent to the agency, and let's make that possible. An example of one of those use cases as a second part of the TMAP strategy is around what we call 7 and 15-day safety reporting. So if a new drug or biologic is being studied, that is being studied under an investigational new drug application regime. And as a part of that requirement, there are reports that come to us at 7 and 15 days around any safety events, bad events that have happened on those trials. But those reports come to us as PDFs. Now you can imagine we get about 30,000 a year, and then our medical reviewers, usually doctors or MDs or PhDs, are now spot checking and visually reviewing those and trying to find safety signals by visual inspection. In November, we announced a program to now have the pharmaceutical companies and clinical trial research organizations that are doing those clinical trials directly send us the digitized information rather than the digital paper as a way of now getting into structured databases. And that then leads to a book of work that includes, for example, data visualization, new analytic techniques, being able to do signal finding, and a total new set of activities that really is a part of our data modernization efforts. We can't do that, though, without the cloud and the technical underpinning to allow that all to happen.
All right, you mentioned data strategy stuff, so we're going to come back and take a quick break and come back and maybe talk more about that. My guest today is Dr. Amy Abernathy, the Principal Deputy Commissioner and Acting CIO at the Food and Drug Administration. I'm Jason Miller, and you're listening to Ask the CIO, sponsored by Vion and Dell on Federal News Network.